COVID-19. What is COVID-19 and how do we prevent it? COVID-19 is a respiratory disease in humans caused by a new virus. It can be transmitted from person to person. Because this is a new virus, there are still things we don't know, but every day we're learning more about it. Now, a short and brief video on COVID-19.
The virus that causes coronavirus disease is spreading in some of our communities. This disease, also known as COVID-19, is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes. These droplets can spread to the mouth, nose, or hands of people who are nearby, or possibly be inhaled into the lungs. Take steps to lower your risk of getting sick. Here are some things you should do. Wash your hands often with soap and water for at least 20 seconds. You can also use hand sanitizer that contains at least 60% alcohol. Take extra measures to put distance between yourself and others. Avoid close contact with people who are sick. Stay home if you're sick, except to get medical care. If you have severe symptoms, please call 911. Cover coughs and sneezes with a tissue or the inside of your elbow. Only wear a face mask if you're sick and around other people, or if you need to take care of someone who is sick. Clean and disinfect frequently touched surfaces. Older adults and people who have severe chronic medical conditions like heart or lung disease or diabetes are at higher risk for more serious illness from COVID-19. This group should consult with their healthcare provider about additional steps to stay protected. For more information on COVID-19, please visit cdc.gov/COVID-19. Let's work together to protect ourselves, our families, and our communities.
How does COVID spread? COVID-19 spreads mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouth or nose of people who are nearby or possibly inhaled. Spread is more likely when people are in close contact with one another, about 6 feet apart. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their mouth, their nose, or their eyes. This is not thought to be the main way the virus spreads, but we are still learning more about this virus. Is there a vaccine or medication for COVID? The answer is no, not yet. They are working on a medication and a vaccine as we speak, and we're hopeful that it will come soon. The flu. The flu is a question that many people ask, what is the difference? The flu is a contagious respiratory disease caused by a virus that infects the nose, throat, and sometimes the lungs. It can cause mild to severe illness and can sometimes lead to death. The best way to prevent the flu is to get a flu shot every year. Somewhat similar to COVID-19, yet there is no vaccine nor medication for COVID at this time. What are the symptoms of COVID-19? People with COVID-19 have had a wide range of symptoms, ranging from very mild to very severe. Symptoms may appear anywhere from 2 to 14 days after exposure to the virus. People with symptoms may have the cough, shortness of breath, trouble breathing, and fever. They may also have some of these other symptoms: chills, muscle pain, sore throat, headache, loss of taste or smell. It is very important that we understand the symptoms, but more importantly, that we know how to prevent getting infected with a virus. So healthy hygiene is very, very important. We need to help reduce the spread. We need to help ourselves and those around us. If possible, we should stay home. We should cover our nose and mouth with a face mask. We should wash our hands for 20 seconds with soap and water and not touch your face. If we sneeze and cough, we need to sneeze into a tissue or into the inside of our elbow, not on our hands. I'd like to show you another brief video on hygiene. Social distancing, also very important in the prevention of COVID-19. This is also called physical distancing. It means keeping your space between yourself and others around you. To practice social distancing, we need to stay at least 6 feet apart from each other, about 2 arm lengths away. We shouldn't gather in groups. We should stay away from crowded places and avoid mass gatherings. Cleaning and disinfecting, another critical component to prevention. We must intensify our cleaning and disinfecting. Clean and disinfect frequently the touched areas. This includes tables, doorknobs, lights, switches, countertops, handles, desks, phones, the bathroom facilities, on and on. Basically, anything we touch, we must wash our hands very thoroughly after we do that and not touch our face. If the surface is dirty, we need to clean it. We need to use detergent or soap and water prior to disinfecting. Again, we must clean and disinfect the surfaces as soon as possible, especially in areas where a person with any respiratory symptom, such as a cough or a sneeze, was in contact with. Also, we must clean our work areas after we're done. So how do we maintain a healthy work environment? Practicing all of these tips and techniques. Also, if ever I or you are sick, we must stay home. If we know of anyone who is sick, we must help them to remind them to report it to their supervisor. If an employee becomes ill while they're on the job, it needs to be reported to their supervisor. The supervisor will ask their employees to go home and to quarantine. Also, again, we must continue using social distancing and never gather with more than 10 people at a time. COVID-19, like I said, can affect anybody from any range of age. But the higher risk populations include those that are over 65, those with an underlying medical condition, lung disease, asthma, heart disease, diabetes, liver and kidney disease, or those who have an immunocompromised system. In Laredo, the local statistics as of May the 8th were that we have 414 people, citizens, who have tested positive for COVID-19. Well, I will say that many have been tested though. We've tested over 2,800 people, and I'm glad to say that the majority, the mass majority, over 2,000 of those who have been tested have come out negative. But unfortunately, 17 people have passed away. COVID-19 is a virus that can infect anyone. We need to take care. We need to be careful. If you or anyone you know has any questions regarding COVID-19, there are some numbers that you can call at the Laredo Health Department. The Laredo Health Department number is 795-4954. Another number that you can call for emotional support at the Laredo Health Department is 795-4905. We at the Laredo ISD Safety Department are also here to help you. If you have any questions or concerns, you can call our office at 273-1171 or 273-1172. COVID-19 is something that we need to be all very careful with. We need to take care of ourselves, and we need to take care of those around us. Use care, use caution, and be safe.